We're so excited to hear from you.
Well, first thing, I
Okay.
applaud you guys for coming here and speaking with us. I think that takes a lot of tremendous strength. And one thing I really wanted to say is please don't ever feel the stigma of having to take an opioid. You know, if there's anything that this task force wants to do is to destigmatize this whole process. You need to be on what you need to be functional, to be able to live your life, and whatever we can do in the healthcare arena to make sure that you can walk into a clinic and be on the medications that you need to be on and not feel that kind of shame, and I'm going to say it loud and publicly right now, is that there is no shame in taking medications that you need to take in order to be functional, period. And we're going to say that loud and clear again and again and again. Absolutely no shame in it. For the rest of you, I applaud the fact that you sought the kind of therapies or treatments that help reduce what you might need, whether it be massage therapy, whether it be music therapy. You know, that's actually some of the things that we've talked about. I don't care whether there's evidence out there about it or not that's been peer reviewed. The evidence that matters is that you perceive that it actually helps you. That's what matters. And if it does, then it needs to be compensated for. It needs to be paid for in addition to all the other things that you have, whether it be medications or other therapies that work. So you guys have actually validated a lot of what we have been talking about. It's important that we hear it directly from you. It makes us feel a bit better because it makes us aware that what you're talking about in real life is actually some of the recommendations that we're putting out there. So again, thank you very much for that.
A lot of us have in common that we've had depression and or suicidal thoughts or even attempts, and there's also stigma on mental health and treatment for mental health. And I think that everyone should know that, you know, chronic pain and depression and or anxiety, I learned, is wired together. And one can make each other worse. And that should be part of the comprehensive plan, and not to be afraid of it, you know, for patients, and to just level the playing field, you know, enough of the stigma. I feel like I have a trifecta, you know, chronic pain, opioid use, and mental health. So you know more about me than probably 4 or 5 people in my life.